I'm Allison Adams with the Foundation for a Healthy Kentucky, and I will talk to you today about how all payers claim databases benefit the payer. When health systems, state policies, and consumers improve efficiency in healthcare utilization, payers benefit. We are interested in what it looks like in achieving higher value and lower costs, and ultimately achieving a better health for Kentuckians. Public and private payers can utilize all payers claim databases. They can utilize that data to analyze health trends of the population, utilize the services, what services are people utilizing the most, and compare costs to other plans' populations. Payers can also use an APCD to develop quality measures and analyze geographic variations in healthcare. You heard from Dr. Talbert in regards to utilizing the quality measures and understanding where the utilizations are happening in certain geographic areas. And from a payer perspective, understanding where those gaps are or where you can improve quality informs better policy for improving health outcomes to your beneficiaries. There's also potential to analyze episodes of care and respond more efficiently by creating bundled payments and thinking about where you're having individual pieces of care where you can start to bundle services and payments to providers. A study by Community Care of North Carolina demonstrated some effects of an education-based intervention targeting individuals with 10 or more CT scans within a year. However, North Carolina does not have an all payers claim database. And so one of the limitations of this study was that there were a large number of people that entered and exited the Medicaid system in North Carolina each year. And so it was difficult to track that individual across the private and public insurers. So although they recognized that there was potential to improve quality and reduce care for a frequent utilization of CT scans through education, they were unable to track those patients moving in and out of Medicare, so they're Medicaid, therefore unable to follow them and therefore improve quality of care and reduce costs. So not having that complete look at utilization through claims data impacts all payers, and understanding utilization across payers could benefit the payers, the consumers, and therefore decrease the total cost of care in Kentucky. Next slide. Payers like health systems already have extensive healthcare data on their covered beneficiaries. We know this already, and they are engaged in analyses and programming to improve the healthcare efficiencies of the beneficiaries they cover. So, for example, insurers individually are already actively involved in analysis of beneficiaries that use emergency departments. We've heard a lot of policies in Kentucky around hospital ER utilization and understanding that certain beneficiaries or Kentuckians are subject to readmissions and high repeat in imaging and otherwise other large cost of services. So we know that there are tracking mechanisms within each different sector or siloed systems of care that are monitoring these, but we don't see those trends across all of the payer systems in order so that we could inform policies. So seeing these trends across all payers can inform policies that ensure those care management services aim to improve quality and efficiencies of care. And this would benefit payers because there is an opportunity to improve quality and reduce cost. For example, in Oregon, researchers are using their all payers claim database to compare real-world pharmaceutical usage within clinical trials to help ensure and establish better price drugs. And so seeing that in the clinical trials and looking at it over their entire beneficiary, they're able to see what that cost looks like in improving quality and outcomes. So one of the concerns that raises regarding all payers claim database is the increased payer reporting burden to the insurer or to the payer. And it's a potential cost, unfunded cost to participate in the all payers claim database. So ever-changing reporting and structures that are not connected to the data public and private payers currently collect can lead to increased payer reporting burden. That is true. However, in states that have implemented an all payers claim database, they are showing evidence that APCDs could ultimately reduce the reporting burden, that payers could all likely have reduced costs as it relates to providing the data to an all payers claim database. So for example, Massachusetts is offsetting their payer burden by allowing data from all payers claim database to replace some of the existing required plan filings. So I think that that's one of the benefits that we as payers and that our payers who are operating in the state of Kentucky could also benefit and advocate as we are exploring all payers claim database here in Kentucky, being a part of the conversation to advocate for what are the required reporting filings in the state of Kentucky by public and private payers, and how can an all payers claim database limit and reduce some of those reporting requirements in order to have more efficiencies and realize more efficiencies to the payers. So ultimately, there's an opportunity to not only improve quality and cost for payers, it's also can potentially look at reducing their reporting requirements for that payer in the state of Kentucky, and also have a clear picture so that there is the opportunity to not only provide better care for Kentuckians, also inform state, local, and employer and insurer level policies, but ultimately reduce the cost for all of Kentuckians. It is shared pieces of information that, when come together in an all payers claim database, can provide that quality of care by informing policies across all sectors, public, private, government, and employers.